Here are 10 Puerto Rico Medical Board-style clinical vignettes focused on neurodegenerative diseases, each with 4 answer choices and detailed explanations. She has neurodegenerative diseases vignettes. 1. Alzheimer's disease. An 80-year-old woman presents with progressive memory loss, difficulty finding words, and getting lost in familiar places. She has no focal neurological deficits. MRI shows hippocampal atrophy. What is the most likely diagnosis? A. Vascular dementia. B. Alzheimer's disease. C. Lewy body dementia. D. Frontotemporal dementia. Answer B. Alzheimer's disease. Explanation. Alzheimer's disease is the most common cause of dementia, characterized by early memory loss, hippocampal atrophy, and amyloid plaques tangles. Shot 2. Lewy body dementia. A 74-year-old man has progressive cognitive decline, visual hallucinations, and Parkinsonian symptoms, rigidity, bradykinesia. His symptoms fluctuate in severity. What is the most likely diagnosis? A. Parkinson's disease. B. Lewy body dementia. C. Frontotemporal dementia. Normal pressure hydrocephalus. Answer B. Lewy body dementia. Lewy body dementia presents with early hallucinations, fluctuating cognition, and Parkinsonian features. It is associated with alpha-synuclein aggregates, Lewy bodies. 3. Frontotemporal dementia, Pick's disease. A 60-year-old man has severe personality changes, inappropriate social behavior, and apathy. His memory remains relatively intact. MRI shows frontal and temporal atrophy. What is the most likely diagnosis? A. Alzheimer's disease. B. Frontotemporal dementia. C. Vascular dementia. D. Huntington's disease. Answer B. Frontotemporal dementia. Explanation. Frontotemporal dementia presents with early personality changes and disinhibition due to frontal and temporal atrophy. 4. Parkinson's disease. A 69-year-old man presents with tremor at rest, bradykinesia, and rigidity. He has a shuffling gait and masked facies. What is the primary pathological finding? A. Amyloid plaques. B. Tau tangles. C. Alpha-synuclein aggregates. D. Neurofibrillary tangles. Answer C. Alpha-synuclein aggregates. Explanation. Parkinson's disease is caused by dopaminergic neuron loss in the substantia nigra and Lewy bodies, alpha-synuclein deposits. 5. Huntington's disease. A 45-year-old man has progressive choreiform movements, personality changes, and cognitive decline. His father had similar symptoms. MRI shows caudate nucleus atrophy. What is the most likely diagnosis? A. Parkinson's disease. B. Huntington's disease. C. Wilson's disease. D. Amyotrophic lateral sclerosis. Answer. Huntington's disease. Explanation. Huntington's disease is an autosomal dominant trinucleotide repeat disorder, KG repeat in HTT gene, causing caudate atrophy and movement cognitive symptoms. 6. Vascular dementia. A 75-year-old man with hypertension and diabetes presents with stepwise cognitive decline and focal neurological deficits. MRI shows multiple small infarcts. What is the most likely diagnosis? A. Alzheimer's disease. B. Vascular dementia. C. Lewy body dementia. D. Frontotemporal dementia. Answer B. Vascular dementia. Explanation. Vascular dementia presents with sudden or stepwise cognitive decline due to multiple infarcts. Amyotrophic lateral sclerosis, ALS. A 58-year-old man presents with progressive weakness in his arms and legs. He has both upper motor neuron signs, spasticity, hyperreflexia, and lower motor neuron signs, fasciculations, atrophy. What is the most likely diagnosis? A. Multiple sclerosis. B. Guillain-Barré syndrome. C. Myasthenia gravis. D. Amyotrophic lateral sclerosis. Answer D. Amyotrophic lateral sclerosis. Explanation. ALS is a neurodegenerative disorder affecting both UMN and LMN, leading to progressive paralysis without sensory loss. Multiple sclerosis. A 30-year-old woman presents with blurry vision in one eye, numbness in her legs, and difficulty walking. Symptoms worsened over a few days, then improved. MRI shows paraventricular white matter lesions. What is the likely diagnosis? A. Multiple sclerosis. B. Guillain-Barré syndrome. C. Myasthenia gravis. D. Chronic inflammatory demyelinating polyneuropathy. Answer A. Multiple sclerosis. Explanation. MS is a demyelinating disease that presents with relapsing remitting neurologic symptoms and paraventricular plaques. 9. Normal pressure hydrocephalus. A 70-year-old man presents with gait instability, urinary incontinence, and cognitive impairment. MRI shows ventricular enlargement without cortical atrophy. What is the likely diagnosis? A. Alzheimer's disease. B. Normal pressure hydrocephalus. C. Parkinson's disease. D. Vascular dementia. Answer B. Normal pressure hydrocephalus. Explanation. Normal pressure hydrocephalus presents with the classic triad: gait disturbance, dementia, and urinary incontinence. 10. Wilson's disease. A 23-year-old man has tremors, psychiatric symptoms, and jaundice. Slit lamp exam shows Kayser-Fleischer rings. What is the best initial test? A. Serum ceruloplasmin. B. CSF analysis. C. MRI of the brain. D. Muscle biopsy. Answer A. Serum ceruloplasmin. Explanation. Wilson's disease is a disorder of copper metabolism causing neurological and hepatic symptoms. Low ceruloplasmin confirms the diagnosis. Final thoughts.